Good morning, my name is Olivier Mir. I'm a medical oncologist in Paris, France. I will tell you a few words about why you should contact an expert for a second opinion. The first reason is that for some cancers, there's not always one and unique good way to treat adequately. And an expert can advise you on how the treatment can sometimes be personalized, taking into account your medical background, your preferences, and your obligations, especially in terms of professional activity. So we can sometimes adjust, modify slightly the route of administration of the treatments, go for oral treatments, for instance, the schedule of administration, and so on. What we can also offer through an expert second opinion is an opinion on the management of side effects and supportive care, an advice on the optimal duration of treatment, and envision what would be the next options. Experts listed on our website were identified by their contribution to clinical trials, which represent the best opportunity to get access to the most recent cancer treatments. They can suggest, for instance, to participate to one of these clinical trials. Finally, you can check that all the options have been encompassed and ask why some of them have been rejected. Finally, in the context of rare diseases, experts in large volume centers might have a different experience and access to the most recent clinical trial data on one drug or another. So this is definitely an asset for patients with rare cancers. What about your treating oncologist? Well, sometimes people feel that the treating oncologist does not have enough time during the scheduled appointments to answer all the questions. And you may also have questions after or between the appointments. So basically, the treating oncologist will be interested in the opinion of an expert colleague and will even sometimes refer you to an expert on his own initiative. What we need for a second opinion is the exact diagnosis and stage of the disease. This means pathology reports, surgery reports, treatment doses, dates, and activity. The most recent imaging data, CAT scan, MRI, and so on, an overview of your clinical status, weight, fatigue, lab exams, and an idea of what was offered to you by your treating oncologist, your questions, and your expectations. What we do is first take time to understand your medical condition. So this is a major advantage of an online second opinion, not to mention avoiding travel expenses to go to the expert center. Sometimes the expert will take the opinion of an expert team, a multidisciplinary tumor board. And we will send you a medical report with management proposals regarding treatment options, supportive care, existing clinical trials, and sometimes we will conclude that we need a physical appointment. Finally, and in synthesis, I would say, I truly hope that this makes things more understandable to you, and please do not hesitate to contact us.